If you could change one thing about the system overnight, what would it be?
You know what? Interestingly, my knee jerk reaction is a little bit of two minds. So my knee jerk reaction when you ask the question is, oh, let's do a big national EHR that everybody can get into. Let's find one system
Mm,
that we all have access to from the patient side and from the clinician side, and let's just share all the information. Um, and then the reality of the complexity
mm,
of our system sets in and goes, well, now wait a minute. Even as an informaticist, one of the things that I would tell people when they are exploring like a rip and replace scenario is there is no one perfect system. There's only the needs that you have and how well that platform meets those needs.
mm,
So the likelihood that we could even put together a system that will meet the needs of all these different practices, different specialties, different frankly different modalities of delivering care, different ways of managing practices. And I think that's part of the challenge that CMS and other payers that are putting these programs together are faced with. I think that's why they say things like, "Well, we don't want to tell the clinician how to run their practice.
mm,
What we want to do is give guidelines about what the outcomes, where our outcomes need to be and
mhm.
how everyone is performing." But if I was going to say one magical thing, yeah, that's probably it would have to be a magical EHR that actually fits everybody's needs regardless of what your needs are.
Well, I mean, I'm not surprised to hear you say that based on your background. But regardless
Mm,
of the how part, in terms of just kind of what you just
mhm.
said, is that the outcome it sounds like you're advocating for is access to the information to benefit the clinicians and
Yes.
benefit the patient. And there's a lot of
Yeah.
initiatives in several spaces to do just that. And we know that there's a long way to go.
Absolutely. I think that the HIE space is really, really fascinating. I think the having a place, and there are definitely, like you said, there's initiatives in place. There's organizations and people working on putting together the structure to allow us to have a national health information exchange. The question always comes down to what's the right level of granularity
Hmm.
to be sharing, not only provider to provider, provider to patient.
Hmm.
There's so much that healthcare does to translate the language of healthcare into what the patient can understand and what the patient can take action on.